As we said, I'm here with Dr. Troy Dreiling.
Yes.
Got it right. And from Absolute Chiropractic.
Correct.
Great. How are you today?
I'm great, thank you.
Glad to have
see
you. Had some good talks earlier. I hope
Yes.
we get all this information out. This is going to be good. We're going to be talking about diabetes. It's very important. Seems to be an epidemic, actually, more so in our children. And there's two different types, 1 and 2. You need to explain it more because I don't know enough about it.
Okay, so there's two different types of diabetes. As you mentioned, the first one's type 1, which is, a lot of people know it as insulin-dependent or juvenile onset diabetes. A couple different causes for it. Could be chemical toxicity, somebody had some trauma, surgery, so now they're required to take insulin for the rest of their life. The other type is type 2, which is probably the fastest growing disease right now in America. They're diagnosing about 1 million cases of type 2 every year. There's about 20 million people that have type 2 diabetes.
1 million a year.
In a year, every
Wow.
year. And they estimate that treating it, like medically treating it, will cost you about $10,000 a year for the rest of your life, unless we can show you a way to reverse that, which is what I want to talk about today.
Type 2 is preventable, though.
It is.
It is preventable.
And it is reversible if you're doing the right things. We can actually start reversing type 2 diabetes within 3 days.
3 days.
3 days, without medication, without surgery, just by what you're going to stick on your fork.
Wow. No medication, no surgery. We like that. We talk a lot about that here. Getting back to whole foods, as a matter of fact, eating the right things. So it's preventable. So what is causing this diabetes epidemic then?
Well, one of the biggest things is the choices people are making for their food. You know, we live in the fast food nation.
Oh yeah.
You know, we're always sitting. We don't eat at home like we used to. We don't cook our own meals. So now we're relying on somebody else or some other entity, company, to package our food for us. Which
processing.
And it's destroying our health. You know, it's not that we're genetically predisposed to diabetes. We're actually, our lifestyle is creating it.
Sedentary lifestyle.
Sedentary.
Need to exercise. We talk about that. Getting healthy and going to your chiropractor, getting aligned. What is it that you do or a chiropractor can do to help us with this?
So there's a couple things. One, we'll talk about nutrition more specifically in a second. But
Good.
As a chiropractor, I'm going to evaluate the nerve system. Where's their interference? Gray's Anatomy says the brain, spinal cord, nerves is the master system. At the University of Toronto, they just came out with a study, and they were looking at mice with diabetes, and they were studying the pancreas. So what they were doing is they were injecting painkillers into the pathway, the nerve pathway that goes to the pancreas. Now I wouldn't want that done either.
No.
But what they were finding is when they injected these pathways with these painkillers of these mice, their diabetes would go away. And the researchers were like, oh my gosh, the nerve system's related to diabetes. And so as chiropractors, we've been talking it since day one.
Yeah, for years.
Your nerve system's related to everything, not just
right.
diabetes, you know?
That's right.
That's why you see, sometimes somebody will come in, their blood pressure will get better, their diabetes will go away, their dizziness will be gone, their acid reflux clears up, their constipation goes away. I recently had a patient, Tommy. I've been working with him for 10 years. They've had him on metformin, which is it's a drug that treats type 2 diabetics.
Okay.
And blocks glucose production in the liver, so it's, they're not able to produce it, but it's also very damaging to the liver, and there's a lot of side effects. So we started showing him whole food strategies, getting off the sugar, doing some more fat, and every time he comes in to see me now, he's like, I'm off my medication, my medical doctor can't believe it, and it's just from some simple basic changes that he should have been doing a long time ago.
Being more natural.
That's one of them.
Right, getting things aligned. We talk about it all the time. The spine and the central nervous system, it tells the body everything. It's what it does. We talked earlier about balance. There's got to be a balance in the sugar, and you mentioned fat. Okay, so how does that affect? I don't understand this, because type 2 diabetes tends to, I see people gain a lot of weight. Why is that?
Well, it's a hormone issue.
Okay.
And so insulin is one of the most powerful hormones on the planet. Bodybuilders, actually, if you study bodybuilding, that's one of the hormones they'll take actually to double their cell growth. Now there's a whole nother thing behind that, but insulin's a very powerful hormone. And so there's another hormone that follows insulin. It's called leptin. It's the fat burning hormone.
Leptin.
Leptin.
Okay.
So you got the not Lipitor, like the cholesterol drug.
I didn't say that.
I know, but a lot of people think of Lipitor. No, it's leptin.
Leptin,
And so
okay.
there's insulin, which tells your body to burn sugar,
Right.
and then there's leptin, which tells your body to burn fat.
Okay.
Most people are sugar burners. because they're eating all the sugar. So if we have a diabetic come in type 2, we say get off all the sugars. Why? So we can turn the insulin hormone off. So then if you're not going to burn sugar, what are you going to burn?
Fat.
Fat. So we want people to be fat burners, not sugar burners. And if you look at, when I was training for marathons, I had this world-class marathon coach training me. He said 80% of your heart is using fat as its primary source of fuel.
Wow.
So if we could get more people, and that's when we started seeing all these heart issues, back with the Jane Fonda craze, the low-fat diets, that's when we started seeing more increase in diabetes and sugar-related problems and obesity. So it's a hormone issue. If we tell patients get off all the sugar, anything that turns to sugar.
That's the key.
That's
too.
key, like grains, fruits. We recommend berries in moderation because it doesn't spike your insulin. Neither do Granny Smith apples, to name a few.
Granny Smith apples.
Granny Smith apples, not the Red Delicious, but the Granny Smiths.
Ah,
Because they don't spike your insulin like the red ones do.
well, that's interesting.
So just a little tip there, but so we get them off all the sugar, grains, everything that turns to sugar. Then we get them loading up on fats, like more avocados, avocado oil, or almond oil, or olive oil. Those are just name a few. Grapeseed oil, some of the really good oils. Not the canola,
Good oils.
not the safola, not the corn oils, but the really good healthy fats, walnut oil. And so we start getting them to burn fat. So now the receptors, the insulin receptors, will actually start to regenerate within 3 days.
Wow.
So now this is how you get a type 2 diabetic to reverse that and get their blood sugar back under control. I can't tell you how many times I've had patients, that come in after a week or two of care and say, I think I can get off my medication now. Just by these basic changes. We're starting to adjust their spine, getting their nerves clear, cleaning up their nutrition, getting them hydrating more. Then we start showing them how to exercise, because that's another component to this.
Oh, yeah.
So instead of burning the sugar through your cells, you burn it through exercise.
That must be exciting.
Yeah,
To have a patient come to you and say, I think I can get off my medication.
Oh, that's the best. That's the
know.
best thing, because you're like, yes.
Because we know there is a need for some medication.
Yes.
We do know, for example, like you said, type 1 diabetes, they're going to have insulin. If they
Yeah.
didn't have this, they would possibly die.
Yeah.
And most likely they would.
Yeah.
So there is a place for it, but we talk about getting off of this stuff.
Well, Advania, which is one of the was very common a few years back. 6 million people were on this drug. There was a 64% greater chance of having a heart attack on the drug, 73% greater chance of having a cardiovascular accident, like a stroke or a hemorrhage or something like that, just by being on a drug, when we can simply just show people, get adjusted, eat the whole foods, get off the sugars, increase your fats, start getting some exercise, getting back in balance with nature.
Educating. Getting the balance, putting everything together. We're still back to whole foods. I hear a lot of that. You were talking about flours, for example. We talked about that earlier. What were you saying about white flour or whatever? They do what now?
Well, if you have a wheat germ, they're going to strip off the germ, they're going to strip off the bran, and all you're going to be left with is endosperm, which is basically, once it hits your mouth, the digestive enzymes in your mouth turn it into sugar within 3 seconds.
Wow.
So
again,
instead of it being a whole food, they've stripped it all apart, and now you're just left with this white refined sugar, or basically sugar, but it's
Right.
flour.
processing, refining it, getting something that's not natural
Right.
is the biggest deal.
Yeah, and then that just robs nutrients out of your body even more.
Right.
So it just compounds itself.
So you got to get it balanced. We got the spine, everything's in line. Go see your chiropractor.
Yes.
Education. Educate the people on whole foods and getting everything balanced and eating properly, good nutrition, right?
Yes.
That's the answer. 3 days, he can reverse diabetes. That must be exciting.
Yeah, it's exciting.
Have a patient do that.
Yeah.
Come and say, I don't need it anymore.
Yes.
This is great.
Yes, thank you, Kelly.
Thank you for coming.
Yes, you're welcome.
You feel you have diabetes, high blood pressure, whatever, go see your chiropractor. Get aligned, get into balance with nature. Thanks again.
You're welcome.